Hey, what's up everybody? Jed Johnson here from dieselcrew.com. Of course, you know they call me Napalm. This is the first video in the series from when I went up and saw Dr. Jim Wagner to get my hand therapy done. We started out with some Hawk grips, instrument-assisted soft tissue mobilization. I wasn't real good about doing an intro for each section because we were trying to get everything done. So I'm going to try to set each video up with one of these quick intros. Hopefully it helps out. And if you have any questions, leave them in the comments section. Be sure to subscribe because this is going to be coming in like 4 or 5 parts. And wish everybody all the best in your training. Take care.
Is that flexor tendon as it comes in and along down there, and I just think it's, I imagine if the doc were to cut that open, which we don't want to, middle finger, right? Yeah.
There's like, you know, I looked at a picture of the interosseous, and it kind of curves like this, right?
So
this yesterday in this part of my finger, and
right,
you can feel it's really gritty right there. So
right there, yeah.
Can you feel,
Yeah,
right there.
Yeah,
it flips a little bit.
So the interossei are, there's 4 dorsal on the back of the hand and 3 palmar. They're very deep. Yep. So
that's what I saw.
First one here, dorsal, and this one is bifid, it splits, and they usually come around. There's one here, one on either side of this finger, and then one over on this side over here. So they spread over here, and they'll come along the side and insert. Then the lumbricals, which help to bring the hand down like this too. They come along the radial side, so they kind of insert right along this area over here too. So now when you make a tight fist, when you squeeze hard, it doesn't hurt between the knuckles, right?
No.
Okay.
But I can feel, and I'm sitting, and like when I'm driving like this.
Oh,
my fingers are not,
okay.
like it's developed like some kind of a inhibition or something. Like it's staying away from that position because these 2 joints on both of these fingers actually are tender.
So so that they will. So they want to flex the big knuckles and extend the interphalangeal joints. So really, those lumbricals though are really more for what they call it, you know, like a proprioception, like the excursion and flexibility. So when you make a fist, they've got to relax. Now when you go make a fist, your finger doesn't stick out like that at all, right?
Kind of.
Okay.
Not so pronounced.
Yeah.
But I think there's,
because sometimes again, and we'll go back up here and do this again just to see. Again, big knuckle back, and this is just to go over your stretches. That big knuckle back, and then just that middle joint. That's going to be your stretch. Actually, feels. Is it painful?
a little bit. Not.
It feels a little bit better, Jed, than you did than last time. At least the flexibility.
Dude, I've been stretching. Dude, I've missed maybe 4 days.
Yeah.
Like, and one night I was like, I can't miss again. So I did them while I was laying in bed.
So if you notice here, again, relax. Sorry. If you notice here, relax. It's really stiff in that position, and then you go. As soon as you drop it down here, you curl right up in there. That's that interossei. So that's interossei tightness. So that's definitely it for sure. Okay. I think it's definitely part of it. So turn your hand again like this for me. So I know it's tough for you to turn your palm up. Try to bend the middle joint again for me. Okay. Hold. Any pain with that at all?
No.
Okay. Hold it there. Any pain with that?
No.
Okay. Relax. Let me just make sure. Bend the tip of your fingers, all of them together. Good. I'm going to pull. Don't let me do it. Pain with that at all?
No.
Okay. Now pull your fingers up like this. So when you go to set, and this is one of your grippers right here. When you go to set that gripper and you squeeze, it's the middle finger. Yeah. And that's, is it when you first initiate the grip, or is when you try to hold it there?
More like the closing, touching handles together.
All right. So I'm going to stay with that. So superficialis comes here. That superficial bifurcates, and the profundus goes right to the tip of that finger. Now your pain.
Sometimes I feel it in there.
Sometimes there. Not so much here.
Right. When it hurt for 2 days after training, it was right in here.
Right. Here.
That is where there's stuff lingering all the time.
So A1, A2 pulley, there's 5 annular pulleys. So A1 and A2 kind of blend together right here. And then you have a cruciate pulley, and you have A3, and then A4. Those are and then there's a sheath that the tendon runs through there. So I'm wondering again with that gross flow, when you really pull that down, you make a tight fist now, and it doesn't stick on you, right? It doesn't kind of slip or pop or like that at all.
Not during the closing. When I extend my fingers.
Do you feel it catch a little bit?
I feel it, but I can't even pinpoint where it's at.
Okay, but does it feel like it just kind of like
a little bit?
A little bit.
But it's more from here to there.
Okay, all right. So that makes sense. So again, that will tell us maybe in and along that profundus there. Did that brace help at all or not, or did you not even wear it? That's okay. Either way, I mean, because it doesn't matter. I just wondered, what's the.
I wore it, but like it felt weird.
Okay, all right. If obviously it's not. I mean, so I don't think it's going to either. If you were more acute, like it just happened within the last few weeks or something like that, it may help. Like this has been a long time. So yeah. So all right. Let's see if we can't get in here. Loosen this baby up. Yeah, I was off today, doing some work for the school classes this morning. Speaking of that, we got to get you on our podcast. So maybe like I think we got someone lined up for October, but maybe like November or something like that, and we'll talk about. So we got a thing on. It's called Getting Handsy.
Yep.
And so Bob and I, Bob is a hand therapist from down in Georgia, and he runs a low country hand therapy down there. Great guy, and so we'd love to get on and talk about grip strength, like power grip strength, and like some of your achievements and stuff like that. And then talk about like what you do and get you out there more and stuff like that too, and then get you exposed to the hand therapy world, stuff like that too. Yeah. So that'd be great. So we try to get different. Everyone always has like the same old. Kind of presenters and stuff on. We want to get something different out there, so.
Yeah, that'd be fun.
Yeah, it'd be great. And it's real laid back.
Is it video?
No. We do it Zoom. It's only 45 minutes. We're low, this, like you get the free version, so we just do the 45-minute free version, whatever. So we'll give you like 5 questions ahead of time, so there's no surprises. We'll just let ad lib as we go along. Usually we have a drink in our hand or something like that. So that'll be on Zoom. And then, and then what we'll do is he'll whatever the audio and stuff like to it, get it on Spotify and that there, and then we'll put it out. That'd be great.
What's the name of it?
So it's called Getting Handsy.
Getting Handsy.
Yeah. So Bob named it a while back, and so he asked me to come on board with him and do a little bit. It's been a lot of fun. So
yeah, everybody's got to check that out for sure. That would be good. There's lots of good stuff on there.
Yeah, lots of good stuff. So we do things like anatomy on there, about some of the things all related to hand and stuff like that. So it'd be great to have you talking about grip sports. Formulation of grip strength, and even your experiences and stuff like that, and some of your records and what you're in your products and stuff like that, things you do too as well. So we're going to work, just going to try to soften stuff. We're going to work right on this palmar fascia comes up along. This is the most superficial underneath the integument. So that blends with all the other carpal tunnel right here, 10 structures that run through there. And then there's the network of nerves runs through, and they start to break off and branch into the proper and common digital nerves right along the side of the finger. So once you get below these calluses, and so then you can work through the soft tissue on the top just to kind of loosen that tissue up a little bit first, and then we can dive a little bit deeper. But you always want to be careful, especially with these that we're not putting a whole lot of pressure on the side of the finger. You ever just bang that finger, your fingers goes numb? Yeah. So all I'm going to try to do is tease out that. I'm going to try to get a little more aggressive with the jet than we did last time. So it's already the point where we've got to do something. So we're in that phase where we got to get that concept of mechanotransduction. We're going to do external pressure to create some internal changes, but we're going to go a little heavier handed to do one for, I think you can take it. And two, I mean, you're like, this is a chronic thing at this point. And to tell you the truth, we used a little bit of force last time. We used a little bit more this time, and see if we make a difference with that.
Yeah, sounds good.
So we'll just work right here. So carpal tunnel, the superior portion of that is right there. So, and then it's not very thick at all here, and then through that, it's only about 17 millimeters or 3/4 of an inch. So in that area there, like I said, there are 10 structures. The 9 tendons that come through here, 4 here, 4 here, one at the tip of the thumb, and that nerve is nestled right in through here and branches off into the hand and breaks off here. So then it breaks in again from here into your interossei, your lumbricals are on top here, your profundus, your superficialis, and then they go up into your finger flexors. Yeah. So it's really this part of the hand. It's all quite amazing, but there's 18 muscles alone just in through here.